Voilà. Bienvenue, chers collègues. Merci pour
Welcome, dear colleagues. Thank you very much for this afternoon's panel. This afternoon's panel is called in French Educate with sensitivity across visions of education to sexuality and education to sexual and reproductive health. I'm Romeo Matsas. I'm responsible for the international service in the Christian Mutual Societies, and I'm your host this afternoon. So thank you very much to the organizers for inviting me and for asking me to fulfill this role. We're going to speak about sexual education to sexuality. It's very important to have a reflection about this extremely important challenge for young people. Young people need help, have always needed help to discover this part of their existence and their future. Young people fall in love, they want to discover their feelings, their affective life, their sex life. It's part of their experience, but very often societies are going to endanger them through difficulties and taboos. It's a very old story. You will have noticed in the program, my name is Romeo. The history of literature is full of these love stories, unfulfilled love stories. Romeo bears witness to that, the historic Romeo. So it's very good that we should be able to support these young people in the exploration of their sexuality. So we're going to hear different experts. First of all, we will listen to Carla from KU Leuven. She's going to make a more academic presentation about a research work that she carried out in Tanzania. We'll have two colleagues connecting from Benin online, Bernice from the Ministry of Social Affairs and Microfinance from Benin. Also Jessica, who is going to shed light on her experience in the Democratic Republic of Congo. And we will also have Bonita, will also from Annabelle. So each speaker will have about 10 minutes to make their presentation, and after the presentation, we'll have a session and answer session.
Welcome. Thank you for being with us today. Professor Van Leeuwen is professor in parenting and family studies at KU Leuven's Faculty of Psychology and Educational Science, and you will be presenting us your project research on Tanzania. Thank you.
Yes. Thank you for inviting me. I'm happy to present some results about this project, which of course I did not alone, but in collaboration with a very nice South team from the Open University of Tanzania with my colleague there, Janet Kigobe. So, yes, this works. First, I want to present some key challenges in SRH education in Tanzania. We know that there is some gender inequality because there is a high dropout rate in secondary education, especially in girls, because of unplanned pregnancies and early marriages. Also, there is some education at school, but this focuses mainly on biology and lacks some practical and social dimensions. And often teachers think that their knowledge and skills in SRH education is not sufficient. Also, peers are very important in for young people, and they often serve as an SRH information source, but often also they provide incomplete or inaccurate information to their peers. There is also little collaboration between teachers and health professionals, and also a lack of involvement of parents. Now, we developed an intervention. This is a VLIROS project, and we focused on 2 rural regions with a high percentage of teenage pregnancies, namely in Katavi and in Tabora. And we focused on 4 key stakeholders. The first group, of course, are the youngsters themselves, the pupils. We focused on children in grades 5 and 6 of primary school and grades 1 and 2 of secondary school, and also on their peers. So we developed a program and we invited peers to be like confidence, reliable confidence for their schoolmates, and they were elected, one boy and one girl for each school. We also included teachers and healthcare workers, midwives as professionals, and we trained them together so to foster the communication between these two parties. And then lastly, but also very important, we involve the parents so that also parents know what we are talking about in this intervention, because we think it's very important that all stakeholders are on the same page so that youngsters don't hear information from different parties that is contradictory. In this project, we had several steps. The first step is that we organized what we called tea chats. So we invited all the stakeholders for groups sessions, and we let them talk and discuss about this topic of sexual health education. And this allowed us to see what their needs are, but also it helps them to get them on board of our project. So we think that was a very step that they also participated from the start in this project. In the second step, we developed the intervention content, and we used experts both from the north and the south. Then an also very important step is that we required permission from official bodies, and especially the Ministry of Education, because if you have an intervention at school, the ministry has to allow this. And then in the fourth step, we trained the teachers, the health workers, and the confident peers. Then we implemented the intervention in the schools, and Katavi was seen as a pilot project. So this could inform us for next steps in Tabora. Then we developed for Tabora some Zoom and Moodle platforms to roll out the intervention more widely. So now we have an intervention that can also be used in other regions in Tanzania. And then we also had an evaluation to see the effects of the intervention. Here, oh, sorry, I was wrong. Here you can see all the intervention components. So we had 17 modules. I will not explain them one by one, but it is important to see that we focused on soft skills also, not only on the content about what is going biologically in the body when adolescents grow. So for the soft skills, we worked with discussion about real life situations. For example, we talk about a girl in the class that is pregnant and what you can do to support her. And then another scenario could be that a girl is asked to provide sexual acts in exchange for presents, and how can a girl react to this? So a lot of social skills on social media, communication skills, consent in relationships. Then we did an intervention study in which we used a comparison and an intervention group, and we had measures at 3 points in time to see how the attitudes and beliefs of all the stakeholders evolved over time. And for the professionals, we could see that there was a significant improvement in facilitation of SRH education. They had other goals regarding SRH. They perceived more the benefits. They felt more confident in providing sexual education and comfortable in talking with students about this topic. Also, the teacher-student relationships were more strong. In the parents, we saw a shift from toward more shared responsibility for SRH education, and also increased comfort to discuss this topic with their children. Also, we saw some reduced misconception. A typical misconception is that talking about SRH will lead to early sexual acts. In the students, we saw greater confidence in making responsible choices and more self-efficacy in talking to peers about several topics, and also on different sexual health domains, for example, about consent, giving consent. We also saw that there were more frequent conversations with peers and sometimes romantic partners, and a stronger perception of adult support. And finally, we also saw that the peer lead sessions played a key role in normalizing SRH discussions and reduced stigma. So we were very happy with these results, although we still have to do a follow-up measurement to see how effective the intervention is on the long term. But also some challenges and pitfalls, of course. Specifically for the intervention, we saw that, especially in Katavi, professionals had really tight schedules, and it was hard for them to follow some of the sessions that we organized. So for the Tabora intervention, we developed some Moodles and some online sessions, which we used flexibly, so that really helped. In the parents, we sometimes saw shame or fear of judgment of other parents when discussing sensitive topics. So here, it was very nice to see that in Tabora, parents, they created some kind of communities on a WhatsApp format, and they discussed sensitive topics together without the professionals, and that really helped them to be more open about these subjects. Then the students, there we thought we arranged this, the development of the intervention was focused on both girls and boys, but when you want to define equality in gender, maybe we still need to do some gender-specific adaptations for the intervention, because, yeah, there are some differences in boys and girls, and we should those take into account. Regarding the broader context, of course, in a country and culture, certain topics are taboo. For example, about homosexuality, we cannot discuss this topic at schools. It's forbidden, although, of course, we know that it's there. Then regarding policy, you can see that the professionals, teachers, they follow the rules of the Ministry of Education, and the healthcare workers, such as the midwives, have to follow the rules of the Ministry of Health. And finally, we also have the problem or the issue with religious leaders, for whom the only solution in SRH education is abstination, and their way of handling SRH education is largely spiritual, which is often not realistic for these people. I hope this was in 10 minutes.
On l'écran.
Vous êtes live, donc je peux parler pour un moment.
It was in 10 minutes and it was very interesting. Thank you very much. Nous allons maintenant nous tourner vers les collègues du Bénin.
We are now going to turn to our colleagues from Benin. They are online. So we have André Nouemou, chargé project officer about accountability governance. He works in the project related to support sexual health and reproductive health promoted by Enabel in Benin. And we also have Madame Bernice Lucia, who's the head of social services in the department's direction of social affairs. So André is going to tell us about the initiative concerning sexual and reproductive health for young people and children through comic strips. And Mrs. Lucia will be there for the question and answer session. So André, you are on the screen. I'll give you the floor. Thank you very much. Good afternoon to you all. I'm very happy and honored to be able to join this space to tell you what we've done in terms of our contribution in Benin, in terms of our contribution to sexual and reproductive health. I am André Nouemou, responsible for education. I'm responsible for accountability and governance. My colleague, Bernice Lucia, is going to appear when we move on to questions and answers. Our presentation is about an initiative in the field of sexual and reproductive health through comic strips for for children and young people from infancy to 24 years old. This initiative was taken as a result of the observation of a problem. We realized that young teenagers are faced with many problems and challenges related to their sexual and reproductive health, and these are related to culture or caused by cultural taboos that limit access to the right information, the lack of competence of parents who do not have the proper tools to communicate about sexual and reproductive health, which still further consolidates the silence about the topic, and it also makes even more fragile the educational fabric and the lack of communication with the parents, between children and parents. Only 38% of teenagers, male and female, receive a comprehensive sexuality education, which lead to early sex and unprotected sex, unintended pregnancies, and early deliveries with all the related consequences, sexually transmissible infections that include HIV. For example, teenagers represent 20% of the pregnancies and deliveries in Benin in the Bogu department.
Face à ce problème, le Bénin a pris deux initiatives. La première
In the face of
initiative,
this problem,
c'est
Benin has
l'intégration
taken
de
two initiatives. The
l'éducation à
first
la santé
initiative
sexuelle
is
et
the
reproductive dans les
inclusion of
scolaires
sexual
afin que
and
cela soit
reproductive
divisé
health
comme dans les
education in
programmes
the school
d'enseignement
curricula.
scolaire et l'élaboration
So
d'un
these
guide
topics
de dialogue parents-enfants
are taught through the
pour que les
school
parents
curricula.
puissent pouvoir étudier
And
ce
then
guide-là
it was decided to develop a guidebook for the parents and children, so the parents can use that guidebook and the instructions in that guidebook to discuss the topics with their children. But these initiatives have left aside certain challenges. First of all, this kind of education to sexuality that Benin is promoting is only in an experimental phase and only given in a few schools. It's not yet been scaled up. So that's the first challenge. And the second challenge is that the guidebook that has been developed to encourage dialogues between children and parents is a very thick document of 173 pages, and it's very difficult to use. No parent can come back from home from work and start reading a 175-page book before talking to their children, so it's very complicated. So when faced with those challenges, we decided to be innovative. First of all, ask the right questions by setting clear targets and by choosing a proper support approach adapted to Benin's reality. So we thought about how to build on what is already existing. How can we build those initiatives on and build up on things that already exist? And how can we make efficient the initiatives of the government in the field of SRH education? And how can we make sure that all age groups have access to that information, including the parents? And which were the tools that could be used to make it easier, to make it more playful and more inclusive, and to make sure that each and every target group would become interested in using the tools related to sexual and reproductive health. So we set three main targets, three main goals. First of all, strengthening the parents' skills in the field of SRH education in order to create a new and innovative parenting model interested in those topics and in those issues and talking to their children, which was not the case in the past. The second goal was to consolidate the communication between parents and children and improve their knowledge in order to make it easier for teenagers to have access to the right information and also to provide them with an appropriate access to the adapted services. And then, I'm not sure the slides are following my speech actually, because sometimes I click on them, but they don't move. And then we focused on developing simple, attractive, playful, adapted, and inclusive tools in order to make the dialogue between parents and children more effective. Because we cannot speak of a dialogue between parents and children if that dialogue is not effective yet. Then, given these target groups and these questions, these goals, we have decided to adopt a social innovation approach focusing on children and their parents, a co-creative and playful approach, fostering co-creation, participatory co-creation, and we need to make learning and experience sharing attractive, and we need to mainstream in those learning experiences gender issues and human rights issues. So we cannot leave gender and human rights aside. They must be fully included. And an element that's been very important is that we have strongly encouraged the participation, the full participation of children and their parents in the realization, in the production of the comic strip. So we worked with a team of consultants, but the target groups were involved at all times. And they could give their opinion and they could make proposals because we wanted to make sure that those tools were accepted and used by all. So we created different sections. As I told you, the guidebook was 173 page document. So we have divided the document into 4 sections, matching 4 age groups. In each age group, there was a specific topic that was adapted to the age group. The first age group is 0 to 8 years old. The title of the section is My Body Belongs to Me. The young child needs to know that his or her body belongs to her, to him. And the topics that are being developed in the comic strip is respect for the body, for privacy, and the respect of the body, the right to privacy and the prevention of abuse. We saw in Benin that by developing initiatives related to fighting gender-based violence, we saw that there were children from 0 to 8 years old that were already victims of gender-based violence. So those comic strips help create among those very young children the awareness that they need to ask for help and that they can ask for help. Then we have another age group from 8 to 13 years old, and in that case, Fatih, who's the hero of the comic strip, needs to, with the protagonist, the title is Fatih must take care of his body. No, she needs to take care of her body, actually. And the topics that are being developed are hygiene, puberty, and the first periods. Then the third age group, 14 to 17, Fatih and Suru are in love. So it's the age of love life. So the main topics developed in that section are the affective life, the notion of respect and consent. How can these teenagers responsibly start this period of their lives without a deleterious impact on their future? And then we have the last age, the all but last age group, which is focusing on the prevention of early pregnancies. So 14 to 17. Here, the friend of Fatih is pregnant. And the last age group, 17 to 24, there we focused on sexual violence and appropriate reactions after rape. So if a girl of that age is the victim of that age group has been the victim of sexual violence, what should be her reaction? So the comic strip gives all the relevant information about that. And in that age group, we also proposed another comic strip that is focused on contraception and the enlightened choices that are to be made. You certainly understand.
Pour marquer les esprits, les cibles, c'est-à-dire les parents et les enfants, nous avons gardé le même personnage. Donc, un personnage que nous avons appelé Fatih.
Strike the people's mind, we kept the same characters, and this allow us to continue the story, keeping the same character. We could see maybe Fatih later on at university. We could see her getting married, for example. There could be a follow-up to this stories. We also used color codes by age. We can say that such cartoon is for such age. And the language is rather simple and accessible for young people and parents. The messages have to be very clear. They don't need to ask for help. We really try to make it simpler and make it accessible to everybody. Then there is also one story that is illustrated by the teenagers, and then there are keys for a peaceful dialogue or a pleasing dialogue. This helps parents. It is a kind of practical guide for starting the dialogue. So when the parents reads the cartoon, they will not look for any other tool. They have the tool they need, the proposals they need to know how to start discussing with their children, what questions they need to talk about. And this is done in a very synthetic way. Then
Oui, oui.
Je vais vous demander si vous pouvez
André, I will need to ask you to conclude your intervention. Yes, beyond these tools, just want to tell you that we added a game called If You Love Challenge, the Love Challenge. It really helps federating young people around the responses, and we are also developing multifocal approaches that help us reaching a different public. And for this type of education, we have developed different actions like parent schools and an online platform called Carex, where people can get in touch to get answers. There is also a parental support done by social workers and the integration of sexual health education in our different activities. So on this picture, this is a center for young people. It's called Friend of the Youngsters, and they can go there and ask for services. Thank you very much to everyone for listening to me. Thank you, Andre, and I would like to apologize for interrupting you. I am sure that your presentation creates a lot of question. I really would like to have a discussion time with people on online and in the room. And now I leave the room to the young people. Jessica Kalala, you are the director of an association based in Kinshasa, and the floor is now yours. Go ahead.
Allô? Ok, merci. Bonjour à tous et à toutes. J'espère que vous allez bien.
Good
C'est un
afternoon,
plaisir
everybody. I
pour moi
hope
d'être
you are
là.
fine.
Les modérateurs l'ont bien dit, je suis jeune. Donc,
As
on sait tous que la
the
jeunesse
moderator said,
est un peu
I am
représentée par
young.
l'énergie. Et donc,
We
on va
know
faire
that
un
young
tout
people
petit
are
exercice
represented
de 2
by the
minutes.
energy. I would
Alors,
like to make
on
a
connaît
small
tous
exercise
majoritairement le
for a
problème
couple of
que
minutes.
rencontrent les jeunes.
We all
Alors,
know
on
what
va faire ça
problems
par
young
voisin.
people are
Vous parlez
meeting.
français?
We will do that
Alors, on va commencer par Pauline.
neighbor with neighbor. Let me start with Pauline. The
Déjà,
problem is that the lady doesn't speak in the microphone, so the interpreters cannot hear and cannot interpret.
il cite un autre problème et l'autre répond et coquille. Et puis, voilà. Je ne sais pas, oui, juste et coquille. Donc,
The lady really must speak in the microphone.
désolée. Oui, ok. Alors, moi, je vais commencer et puis vous allez répondre et coquille. Ok?
So I'll start and you will reply
Les
echo
méthodes
key.
contraceptives.
Uh,
Voilà. Qui d'autre?
so contraceptive measures.
Ok. La confiance en soi.
Self-confidence.
Bullying. Et coquille.
Je n'ai pas envie d'aller à l'école.
I don't want to go to school. I don't feel like going to school. Employment issues.
Les parents ne me comprennent pas.
My parents do not understand me.
Problème avec les réseaux sociaux.
Social media, issues with with social media. Communication problems.
Je vais quitter la maison.
I want to leave home.
Je trouve qu'on me responsabilise trop en tant que fille.
I feel I have too much responsibilities as a girl. Ancestral beliefs. Pressures in my household. Addictions.
La réaction des institutions religieuses.
Religious institutions' reactions.
Des soucis sur le climat.
Climate issues. Climate concerns.
Maman, tu dois plus m'écouter.
Mommy, you have to listen to me more.
Les violences basées de genre.
Gender-based violence.
Oui, merci d'avoir participé.
Thank
Alors,
you
je
for
reviens sur ma
participating.
présentation.
Let me go and get back to my presentation. So my name is Jessica Kalala. I am the joint director of a feminist association based in Kinshasa. Let me present you the experience of a positive masculinity project. Let me present my organization. Si Jeunesse Savait is a generation of young feminists existing since 2024. We are trying to work with young girls, and we are working in 3 specific areas: sexual and reproductive rights, communication technologies, entrepreneurship, and social justice. Concretely, we are raising awareness among community, capacity building, research and action, advocacy, and many other activities. The positive masculinity and eco-responsible project is a project called EcoKey. It's in Lingala, which is the language spoken in Congo, most of Congo, and it means enough in English. So all the problems the young people were facing, contraception, lack of information, gender-based violence, all these problems, we said ECOCI, it's enough, it's enough. We have to work on that. Now, through this ECOCI project, we worked on all violence, gender-based violence, and we highlighted the fact against toxic masculinity that young people could have towards themselves and towards girls. So through positive actions of these projects, we reach to the positive masculinity and eco-responsible health. This was a reply to inequality between genders because of a patriarchy. The Congolese society is a conservative society, and it amplifies the inequalities between men and women. This is a project that was started in 2022. We started implementing it in Kinshasa and in North Kivu. In cooperation with different funding, and in December 2024, the project was closed, and we will present you the results later on. We now have the key activities of this project. We identified the stakeholders. The project aimed at the pupils, teachers, taxis, motor taxis, and healthcare professionals. So doctors, nurses, pharmacists, all the healthcare professionals. When we identified these targets, we created discussion groups. After creating those discussion groups, we started drafting tools adapted to our targets in order to facilitate exchanges between the group. Then there were some reflection, gathering each target in a 20-person group in order to talk about the issues they were going through, how they lived it, and what kind of changes they could envisage. Then we designed commitment charter depending on the target, and they really committed in one area. Each group have a commitment charter that are important for their reflection group. We realize that every time they are making efforts to try and have these commitments live in their group. Then there were documentation about the vision of change. That was done by a baseline project as a start in order to assess the practices of these targets when it comes to all the problems in the society. We also made another baseline study to assess change before and after the project. And of course, documenting good practices, what we could do, what we could improve if this project would continue. So that's a summary of the results in Kinshasa and North Kivu, the reflections group that were made, the people impacted. As I said, there were a participation of young people, of nurses, healthcare professionals, and also motor taxis. Here we can see the approach, the lessons learned, and the solution. First, the experiential approach. That was a very efficient lever in this project, despite of what each participant lived We started from there in order to understand and allow the others to understand how their attitudes might have an impact on the girls' life, how it could slow down their development. Also, contextual approaches adapted depending on the constraints that we have gone through. This is more about the tools. For boys reflection group, when we talk about gender-based violence or emotion management, when it is said that men cannot cry, is it because they don't have tears? Or what is it? A man is the one using their strength for obtaining what they want. Is it true? A man cannot express their emotion. Why is it so? And then there were also female and emotion management, self-confidence, and how the balance between men and women could be lived. What could the society teach to women that impede her to be more developed in terms of sexual and reproductive health? And we need to have men understanding that a girl having their period is not dirty. So you need to give information also on services, SRH services that are available to her. There were also a most inclusive approach, including sexual minority groups, and we have very constructive exchanges with their needs. Integrating this category of people, we understood that they met specific problems and they should be taken into account. When it comes to institutional support, we are promoted by the presidency of DRC. The president is a champion of positive masculinity, and there will be a day for positive masculinity, and we have different techniques for positive masculinity. This was very important for the project because when activities or campaigns had to be made on the ground, some institution supported us and it really helped us working on the ground. Now, when it comes to the sustainability of actions of this project, we started commitment charters for integrating progressively all this intervention. I have some copies, but I couldn't bring more than that. But we have address books for victims of gender-based violence. We have noted all the places where victims could go to receive care or can be taken care of. We have also an address book where every young person can find youth-adapted services like contraception, any type of information. We have made a brochure with all these services, be it the mobile clinics. We have also noted them in those brochures, and it's available to several organizations with which we are working in order to really disseminate this information. Right. Now, the multiplayer collaboration. There are different networks, Enabel, networks for positive masculinity. Of course, it facilitated work on the ground. And I am done with it. I would like to thank you for your attention.
Voilà, vous m'aviez enlevé le microphone.
All right, you just took the microphone away from my hand. So thank you. Thank you for your presentation. We have learned a new word in Lingala called ekoki.
And the speaker will be Bonita Mpokwa. Good afternoon, Bonita. You are education retention expert for the Binti program, the Girls Empowerment Initiative implemented in Kigoma, Tanzania. Bonita, the floor is yours. You have 10 minutes. Thank you for being with us today.
Thank you very much. It's an honor to be with you today and be able to speak in this platform. For me, I am speaking here today not only as an education practitioner, but also as a person who is really a passionate advocate when it comes to girls' empowerment under the Shabinti initiative. Next, please. So the Shabinti program is a bilateral cooperation program that runs from 2023 to 2027 with the main objective of empowering girls and young women at the age of 14 to 29 in targeted district of Kigoma. So we are implementing the Shabinti in Kigoma, Tanzania, the western part of Tanzania. And our approach is we are empowering these young women and girls through multiple pathways. That includes education, knowledge and skills development, employment, that is empowering them when it comes to entrepreneurship and access of capital and entrepreneurship skills with these girls and these young women. But also, we are also working with these girls to ensure that they're working and living in an enabling environment where girls and young women feel safe and feel supported to be able to pursue their dreams. So our motto is from schools to green employment, where we are enabling these girls and young women to be able to take role and take spaces in the employment and also being the employers in the communities. Next, please. So for this specific platform, I will narrow down to the one pathway, that is education. And our focus is access and retention of girls and vulnerable boys in that age of 14 to 19, but also ensuring that there's quality of learning in schools. That's including improving schools environments as well as capacitating teachers on different skills to improve their teaching experience. Next, please. So I think we can all agree that education and health is inseparables, because you need a healthy child to be stay in school, but you also need an educated child to be able to be an agent of change when it comes to health. So education calls from a multi-sector approach where all actors should come together and intervene to ensure that this child is really educated in a safe place, in a safe space, and also get all the needed requirement for them to be well trained, to be well knowledgeable on issues, different issues, including health issues. Next, please. So in Kigoma region in Tanzania, Kigoma being an underserved community and Tanzania being a developing country, I so appreciate for the first presenter where they presented a program that is, I think it is running or has been implemented in Tabora and Katavi. I confirm for the shared challenges because we also in Kigoma are facing the same challenges and issues around MHM, menstrual hygiene management, issues around sexuality education. The challenges these guys are facing are things like stigma, myth around the menstruation, lack of access to menstrual products, and unavailability of safe spaces in schools, and that can also cause dropouts or absenteeism or dropout. But again, the issues around religious belief, and this could be vividly on issues around sexuality education discussions. It's Tanzania being a religious country, it's kind of seem like it's unethical for a mother or a parent to speak with girls on issues around sexuality before the age of marriage or before them being married. But also issues around institutional challenges. We don't, in Tanzania, until recently, under this new curriculum development, so we didn't have the modules for schools on issues around sexuality comprehensive, where teachers relied on biology as a subject, and for now the students, girls, boys, would only get a little knowledge around sexuality through the biology as a subject. And cultural issues are also a challenge because it is considered an abomination for issues of sexuality being spoken to an elder to speaking to a young person, speaking issues of around the issues of sex, issues of around sexuality. It's considered an abomination. And so girls and young people would get knowledge among themselves, among peers, where mostly this knowledge is not the proper information that they're getting. And that could also lead to issues of early pregnancies, dropout of schools because of these challenges that are facing. Next, please. And so, as with the Shabinti, being cognitive of all the challenges that these guys are facing in the schools that we're working on. So we are in Kigoma, but we are working in 5 districts, and in those 5 districts, we're working in 25 communities, which equals to 25 schools, because in each community, we are working in 1 school per community. So we came up with this innovative menstrual hygiene management, which is a mobile menstrual hygiene management tent, where these tents are revolving around all the communities and all the schools. So these tents create safe spaces for these young people to meet, could be in schools and could be outside the schools. So in schools, the setup is when the tent is there, the students will come in the tents, and we're working in collaboration with the teachers and the educator mandates of education from all levels, from the district, region to national level to the ministries. So these tents will go to schools, and the students will get into the sessions, into the tents, and get all the knowledge around menstrual hygiene management, sexual reproductive health, gender-based violence, and what are those, what to do, and where to go, because we are also linking these tents, these champions who are training these young people in the tents are linked with the health facilities in the communities. So if there is a need of a referral from the young boys or young girls, it's done, whereby these trainers will link these people to the nearby health facilities. So in the communities, these sessions are also conducted where we are focusing on the populated areas. It could be a market day, it could be from the clinic days. So these tents go there where these trainers will be in the tent, the facilitators will be in the tent, and the communities members will get in the tent and get the knowledge. And also this, I also go back to the point where the first presenter mentioned the issues of an involvement of parents. So also this helps on that, because if the parents are getting the same knowledge of issues around MHM, issues around the sexual reproductive health and rights, issues around gender-based violence, if the parents are getting the same, it's easy for them to support, because a child is getting the same knowledge in school or could be in the community, as well the parents getting the same knowledge. So it's easy for them to support. So these facilitators in these tents have been trained by the Ministry of Education, and up to now we have already reached more than 600 people in and outside the schools, whereby we have reached them. So these tents have only started around June this year, and our target is to reach at least 1,000 people in a community, in a total of 25 communities. So this is a module that we are using, and the aim is to ensure that this outreach we are reaching all the communities, even to the hard-reaching areas where the tents will be moved to the communities and to the schools, to be able to get the many number of people in schools and outside the schools to get this knowledge, so for them to be knowledgeable and be empowered on issues around sexuality, menstrual hygiene management, and gender-based violence, so they can use the knowledge and being empowered to be able to sustain in the communities, to be able to live in the communities, and to have safe spaces in and outside the schools. Next, please. So again, we are integrating different approaches to we are integrating different approaches to ensure that this knowledge stays and is really a practical one to the young people, boys and girls in and outside the school. We are also working through gender lens, whereby we are enabling environment for young girls and women. We are working with different women rights organizations. We are working to empower the girls, to give them voices, to ensure that they know what are their rights and what are their needs, so that they can speak out for themselves. But we are also working through the champion of education model. These are trained community-based volunteers, where they are the ones that have been trained by the Ministry of Education and Ministry of Health to facilitate these issues on MHM, SRHR in these mobile tents. But we are also constructing eco-friendly wash facilities and dormitories to be able to provide safe spaces for girls and boys in schools. So for the dormitories, we are constructing only for girls, but for the wash facilities, we are constructing for girls and boys. And again, with teachers' continuous professional development, we were working with the Tanzania Institute of Education and together with the School of Education and the University of Dar es Salaam in Dar es Salaam, Tanzania. So we're working with them under TCPD initiative, whereby comprehensive sexuality education and menstrual hygiene management modules have been developed and have been uploaded. They are going to be uploaded in the system, the LMS system of Tanzania Institute of Education, whereby all teachers can be able to access, even those that we are not in the schools, because we're working in 25 schools. But these LMS can be accessed by all the teachers in Kigoma and in Tanzania. So these modules, once uploaded, we are going to be piloting of these modules to be able to be used by all the teachers, and then all these they can cascade the knowledge to the students. But I'm glad that this first presenter mentioned about these 17 modules that have been developed. I think it will be an opportunity to learn on what is the content, and how can we replicate, how can we capitalize on the already developed modules to see where the alignment, so that we can all together serve the children and youth in Tanzania with the same content. Next, please. So I think from what we have done and where we are right now, I think we could say, and I am here speaking on behalf of the Chabinti team and on behalf of the education team, I think we can focus on little things or the lower-hanging fruits, and it could be a small thing, but with that can create a ripple effect. Something like a mobile tent. It's something that it can be done once it's done in a community. It reaches bigger number of people at one time, and that knowledge can go further away in a very short period of time. So let's focus on small things as we are going to do the bigger things. But let's focus on small things. But because sometimes you could provide a pad to a girl and save her many number days of missing schools, and that could be a bigger thing to them. And again, I know as development partners, we come up with so many brilliant innovations, but in most cases, when the project phase out, the funding phase out, most of these innovations or innovative ideas also phase out with the project. So I think it's time when we start implementing these projects, we start the exit strategy earlier in the implementation phase so that we know when we're gone, these innovations stays and keep supporting and saving the community that we have been saving during the implementation period. So my message today is education is the most powerful tool for health, and health is the strongest foundation for education. I believe that we all know that. Thank you very much. It was really a pleasure being in this platform. Thank you.
Thank you. Thank you for your conclusion and your presentation, and thank you also for making the link with the first presentation, because this is what this session is about. It's about also exchanging among colleagues, experts on this topic, and looking at ideas that we could carry out together. So I would like to open the floor for questions. First, looking at my colleague who has been following online. No question. No question online. Are there questions here in the audience? Someone willing to raise? Who will be the first one? Yes, Madame Pauline. Mais je pourrais vous demander votre aide pour le micro.
Could I ask for some help to circulate the microphone, please?
Merci beaucoup. Madame.
Thank you.
French, English, Français? It will be in English. Yes, okay, please. And introduce yourself, please.
Yes, so thank you very much for all the presenters. My name is Josephine Wango. I work as a researcher and senior lecturer here at the University of Liège in Belgium. And I also work on the field, mostly in Africa. It's my regional focus. So my question goes to our first presenter from KU Leuven. Very interesting intervention project. Could you please elaborate more on how the intervention has addressed the religious belief or influence issues? Because you raised this point. The last presenter from Tanzania also raised this point. I've been also conducting research in Africa in many countries. I think this is one of the barriers that keep coming out. And so what have been done in your project? If any, what do you plan to do to address this critical barrier in the sexual and reproductive health area? Thank you.
Thank you. Je propose qu'on prenne peut-être d'autres questions s'il y en a.
I suggest we might take the time to collect other questions if you have some on the other side.
Il y a une raison. Bonjour, mon nom est Catherine Gigante.
Good afternoon, my name is Catherine Gigante. I'm responsible for the social development and society consolidation in the Belgium Development Cooperation Agency. So we We follow different agencies of the United Nations, and the experts in my team follow different topics such as gender education, SRH education. So I was very interested in all the details you talked about. Maybe it's not a question so much as a remark. I'm 52 years old and speaking with the parents. I'm 52 years old and I'm of Sicilian origin. And I can tell you that when I was a teenager, my parents never talked about anything with me. I think it's changing, and I can see that with my young adults at home. But family planning in Belgium, family planning was really very useful. So it is a basic right. It fulfills a basic right. So I was quite impressed to find out how the parents were associated to the project in Benin. I see the difference with Tanzania. Apparently, when the government is less involved or less supportive, it's not so easy, because you said social workers follow the rules of the Ministry of Health. Is there a not there? Is that a barrier? And in Benin, as I have the feeling that the ministry is supportive of the project, it seems to go much better, much more smoothly. Maybe you'll tell me if there is a real difference, that the involvement of the government makes a really big difference or not.
Bonjour, donc je m'appelle Ferenc Solmachi, je suis responsable des programmes.
My name is Ferenc Solmachi. I'm responsible for programs in Belgium. I would like to say hello to André. I had the opportunity to meet him 2 years ago in Benin when I had to implement a project about gender-based violence and SRH. And also concerning the relationships with everything social and economic, there was a decree of the government in Benin about microfinancing, what we call credit village association, the tontine. We see the link between health and education, and also all the economic aspects, the purchase of input, among others. And I would like to know the extent to which the halting of the microfinance project is going to impact your project in Benin. I suggest that for the responses, we should start with Professor Van Leeuwen, because there was a question directly for you, and then we will see what Jessica has to say, and then we'll go to Benin.
Sorry, I hope that's okay. The question was about religious leaders. Well, in fact, that's a challenge that we encountered. So we don't have the solution. We still are looking for how to handle this problem. But I think that we should acknowledge this perspective of religious leaders, but still try to discuss topics and skills with young people and with their parents, teachers, and healthcare workers, so that, in fact, young people do not have to feel guilty when they are in puberty and they have certain feelings and biological and sexual needs. And I think that they should know this is normal and that we can give them the skills to handle this, but that they, I think it's important that they feel that it's not, a problem when, or that we still accept them as people, as persons, when they should have a problem in this area, and that we need to support them. So even the problem is something that religious leaders are really afraid of, we still have to support the young people and not let them alone in this. Yeah, but I don't have the exact answer how to talk to religious leaders, and also some topics cannot be discussed given the policy in a country, for example, homosexuality. You cannot even talk about this. So it's step by step, I think, that we move onwards. And maybe, what the colleague from Tanzania also said, starting with small steps and then building up trust in all stakeholders, and like that.
Merci. C'est effectivement un problème plus large aussi de mouvement anti-genre et de remise
Thank
en cause
you.
de l'égalité.
Yes, it is a broader movement of anti-gender policies, tendencies. For example, we could imagine that a government could decide to burn contraception methods, contraception products. There was no question directly for me, but I would like to support a remark about the involvement or the support of the institutions, the ministries, and so on. Actually, it is an important element that consolidates the efforts, that sustains the efforts. We can carry out actions, we can carry out projects, but it is also important that our institutions and our authorities should be standing by us in what we do and support what we do. For example, if I take the example of my country in the field of SRH, my country is quite open-minded. We have a national teenage health program and reproductive health program. We have done a lot of advocacy for the publication of the Maputo Protocol in the official journal of the Republic of Tanzania, because it opens up further access for young people to sexual and reproductive health instruments. That instrument was ratified in 2008, but it was having a hard time being implemented because the authorities had not published it yet in the official journal. So we really tried to push it, but we were abused. We were called abortionists. We were told that we were encouraging young people to prostitute themselves, become gay, or whatever. So we worked a lot. We had to do a lot of advocacy to make them understand the positive repercussions of this instrument. And we also had to explain the negative consequences of illegal abortions that actually killed many young women in our communities. And so thanks to all that advocacy work, we succeeded in having it published in the official journal. And that should be the goal of advocacy. Advocacy should convince the institutions and authorities to support our efforts. Thank you. And I suggest that we should turn to our colleagues in Benin, Bernice, among others, because we spoke about microfinance, microcredits, tontines, and also André. I don't know who of the two is going to answer the question.
Bernice avait des soucis à se connecter. Elle nous a
Bernice had connectivity issues. Now she's with us. As she was not with us from the very start, I suggest that I could maybe start to answer and she can give additional information. I would like to thank all the participants for showing interest in our presentations and in what is being done, particularly in Benin. I think there were remarks and comments about the fact that in Benin, there was support given by the authorities.
C'est pas les politiques qui sont favorables à nos interventions
through adopting policies that are in favor of interventions in terms of SRH education. There was the law about the right to abortion. There are clear policies dealing with SRH education for teenagers and young people. And we also have an impressive initiative that goes through the National Women's Institute, where they really fight against gender-based violence. So, with this political range of supports, it is a solid foundation, but the halting of microfinancing scheme hasn't had a very huge impact. It is not, the halting doesn't apply to regular microfinancing granted by the state. It only applies to informal practices such as tontines, the frameworks in which private parties get organized, and sometimes with grinding teeth. But what the Ministry of Social Affairs is granting has not been halted. So with the health program promoted by Annabelle, which is still in the field, we still have a strategy of struggle against gender-based violence, and we have set up monitoring committees that support women and victims of gender-based violence and encourage them to ask for help. That was a process that was put in place with a project called Passives 1, and we are strengthening it with another project called Passives 2, and especially focusing on a project called Hills, Les Collines, and the Ministry of Social Affairs wants to scale that up and extend it as a general guidance to the services responsible for supporting, accompanying, and reintegrating victims of gender-based violence. So this is my comment about the halting of microfinance projects, which it's not comprehensive. It doesn't apply to all microfinance. So I was going to suggest that Mrs. Lucia could maybe add some additional information. I'm looking at the technical team. Is she online? Hello?
Oui, on te reçoit. Tu peux aller.
Yes, we get you.
Bonjour à tout le monde. Désolée pour
Hello, everybody. Thank you. I would like to reinforce what André has just said. In Benin, the Ministry of Social Affairs and Microfinance, but the connection is okay. So I was saying that, can somebody tell the moderator that Bernice is speaking and being translated?
Voilà. D'accord. Il y a une réglementation, comme André l'a dit, une réglementation de la microfinance au Bénin.
Said, microfinance was regulated in Benin. And in terms of granting microcredits of gender-based violence victim, there is the National Microfunding Fund, which is one of the structures under the Ministry of Social Affairs. And thanks to that fund, all the victims of violence, after going through the process of decentralized institutions, these victims are guided towards microcredit institutions, and they get support there, which helps them start an income-generating activity. So many initiatives are taken through the Ministry of Social Affairs. As André explained, there are many initiatives in order to support, that are meant to support the most vulnerable people, especially the victims of gender-based violence. Thank you very much. You need to be very quick because we are getting close to the ending time of this workshop. It is not a question. I only want to make a contribution. I worked in Chad for a number of years, and I saw that there are regions in Chad where sexuality is seen in a completely different light. For example, the mothers do prepare their daughters to their sex life. And they prepare them so they are prepared to do their utmost to satisfy their husbands. In Madagascar, where I come from, there are regions where sexuality is not a taboo at all. But what happens in the end is it's the action of all these religious sects, especially American sects, such as evangelists, and they take they seize the opportunity of the economic and financial problems people have, so they attract people because of that, and then people start thinking differently. They're under the influence of those sects. Thank you. I'm Sandrine Guissou. I'm head of project in the Grey NGO. Thank you very much for these initiatives, for sharing these initiatives, especially the one in Benin, because we also tried to develop an initiative through short text messages that we disseminated among children and among parents with the help of community grassroots agents who proposed subscriptions to those who wanted them, parents and children, and they got at the same time the same messages. For young people, the messages were worded in a way that was very attractive for young people. And for the parents, different words were used. They were worded differently, but they meant the same as the messages that were sent to the children. Thank you very much for this light shedding, different light shedding. So we will have to leave the room to prepare the room for the second workshop. I'm going to share a few pieces of important information. On your chairs, you have the presentation of the next event that will be organized by Educate. It will be the film Impure. You must have seen excerpts during or you could see excerpts during the lunch break. The film talks about the taboo of menstruating. So it will be released on the 25th of November. It will be shown 25th of November, the International Day Against Gender-Based Violence Against Women. We're also on the eve of the International Day for Girls. It is the International Day for the Rights of Girls, with different actions that will be undertaken tomorrow. I'm looking at my colleague from Plan International. If you are in this downtown, pop into the Carrefour de l'Europe and Janekopis, close to Janekopis, and you'll see what happens. So thank you very much for all the contributions this afternoon. Thank you very much to Annabelle for organizing this panel and for hosting the meeting. Merci beaucoup. Thank you very much, Pauline, for working so much on developing this program. And I wish you a very nice afternoon. Thank you.